Diabetes affects your entire body, and your skin often shows the first warning signs. Many people with diabetes will develop skin problems at some point. But here's the thing, most people don't realize their skin issues are connected to diabetes. Studies show that nearly all diabetic patients eventually develop skin complications. Recognizing these signs early can help you manage your condition better. When blood sugar levels stay high for too long, they damage blood vessels and nerves. This makes your skin more vulnerable to infections, slower to heal, and prone to various conditions. Research shows that between 8% to 30% of diabetic patients experience skin changes. Some studies even found that up to 71% of people with type 1 diabetes develop skin problems. Let's walk through the most common skin issues linked to diabetes. Understanding these signs can help you catch diabetes early or manage it better if you already have it. Number 1. Diabetic dermopathy. Diabetic dermopathy is one of the most common skin problems in diabetes. These appear as brown or reddish, scaly patches on your shins. People often call them shin spots. They look like age spots but aren't. High blood sugar damages tiny blood vessels under your skin, causing these spots. About 10% of diabetic patients develop this condition. The spots are usually round, rough, and painless. They can last for months or even years. But they're harmless and may fade on their own in about 18 months. Number 2. Acanthosis nigricans. This condition creates dark, velvety patches of skin, usually in folds like your neck, armpits, or groin. The skin thickens and darkens, resembling velvet. It happens when your body isn't using insulin properly. About 5% of people with type 2 diabetes develop this. It's more common in overweight individuals. While the patches don't hurt, they can be embarrassing. Losing weight and controlling blood sugar often improves them. Number 3. Necrobiosis lipoidica. This rare but serious condition affects about 1 in 300 people with diabetes. It starts as small, raised red spots that grow larger and shinier, sometimes turning yellow. The skin may thin and split, creating painful ulcers. Research shows 66% of people with this condition have diabetes. It's more common in women and can be very itchy. Number 4. Bacterial infections. High blood sugar weakens your immune system, making infections likelier. About 17% of diabetic patients develop bacterial infections, often from Staph bacteria. Symptoms include boils, infected hair follicles, or nail infections. Infected areas become red, warm, swollen, and painful. Number 5. Fungal infections. Fungi thrive in warm, moist areas. Candida is the most common culprit, causing red, itchy, swollen patches with cottage cheese-like discharge. These infections often occur under breasts, in the groin, armpits, or mouth corners. Athlete's foot, jock itch, and ringworm are common fungal issues. Wait, there is more, but do not forget to hit the like button if you think this video is useful. Number 6. Eruptive xanthomatosis. This appears as firm, yellow, waxy bumps on hands, feet, arms, legs, or buttocks. Young men with type 1 diabetes are more prone to these tender, itchy bumps. They're not contagious and usually fade with better blood sugar control. Number 7. Digital sclerosis. This thickens and hardens skin on hands, fingers, and toes, making joint movement difficult. In severe cases, physical therapy may be needed. It's caused by high blood sugar damaging skin proteins. Controlling blood sugar is key. Number 8. Diabetic blisters. Rare but alarming, these painless, burn-like blisters appear on hands, feet, legs, or forearms. They're more common in those with poor blood sugar control and usually heal in 2 to 5 weeks. Number 9. Granuloma annulari. This creates ring, or arc, shaped raised areas on hands, feet, elbows, or ankles. The bumps are red, pink, or skin-colored. Most cases are mild and don't require treatment. Number 10. Dry skin. High blood sugar pulls fluid from your body, leading to dry, cracked, itchy skin. About 13% of diabetic patients experience severe itching without visible issues. Moisturizing regularly helps prevent infections. Number 11. Skin tags. Small, soft growths hanging from the skin, often on the neck, armpits, or groin. About 4% of diabetic patients develop them. They're harmless but linked to insulin resistance. Number 12. Diabetic foot ulcers. These serious sores affect 6% of diabetic patients. Nerve damage and poor circulation mean small cuts can become infected, deep ulcers. Some cases require amputation. Number 13. Vitiligo. White patches form where pigment is lost, often on sun-exposed areas like the face, hands, or arms. It's more common in type 1 diabetes due to immune system issues. While we are in the middle of the video, make sure to watch the video at the above link, 12 minerals and vitamins fire every diabetic must take. It may be of great help. Number 14. Scleroderma. This thickens and hardens skin on the upper back, shoulders, and neck. Rare but linked to poorly controlled diabetes, it makes skin shiny and difficult to pinch. Number 15. Cellulitis. A deep, rapidly spreading infection causing red, hot, swollen, painful skin. Diabetics are more prone due to weakened immunity. About 6% develop it, requiring urgent antibiotics. Number 16. Psoriasis. Thick, scaly patches on the skin affect 4% of diabetic patients. Psoriasis and type 2 diabetes share inflammation links, so managing one often helps the other. Number 17. Yellow nails. Thick, yellow nails signal poor circulation in 5.2% of diabetic patients. Nails may grow slowly or become brittle. Blood sugar control and proper nail care help. Number 18. Thick, scaly skin. Affecting 8.7% of patients, this fish scale-like skin on lower legs stems from poor circulation and dryness. Moisturizing and blood sugar management improve it. Your skin problems often worsen with poor blood sugar control. Research shows higher HbA1c levels, 8% or more, increase skin issue risks. But here's the good news is, most improve with better blood sugar management. Check your skin daily, especially your feet. Use mild soap, lukewarm water, and moisturize while damp. Keep blood sugar levels stable. See a doctor immediately for unusual skin changes. Women with diabetes face skin issues more often. 58% of type 2 patients experience them. But with care, most problems can be managed. Don't ignore skin changes. They could signal diabetes control issues. Early detection and treatment prevent complications and keep your skin healthy. Do not forget to click the like button and subscribe. On the screen, you see an essential video, 10 easy hacks to control blood sugar naturally and reverse diabetes, for you. Thanks very much for watching this video. See you in the next video.